So let us begin with Nash therapeutic study streak for today, and the remedies that Dr. Nash talks about after speaking about berberis are very valuable and very less often used by homeopathic doctors because they don't know how to use, and that is the problem with current homeopaths and the homeopaths of that time. And to remove this obstacle, we should go through all the remedies, read the entire Materia Medica, even if the remedy is mentioned just two lines or it is mentioned in 2 pages or 20 pages. The more you will read, the more you will understand the finer differences. If there is one symptom of one patient out of thousand which will require those small remedies, it is going to be of a great help. Terebinthina and cannabis sativa are the two remedies that we'll take up today because Dr. Nash has mentioned those remedies after Berberis vulgaris. So, first remedy, terebinthina. Now, he goes on in continuation with explaining about terebinthina that this remedy is like Berberis and it has much pain in the back, especially kidney and bladder troubles, all the complaints they will have. So you will see Solidago or Berberis is not the only remedy which we can think of in such cases, but these smaller remedies can also be thought. And he tells then, after telling about the pain in the back, he also conveys that painters working under the spell of turpentine are often seriously affected by it, and there is more strangury, which means tenesmus plus painfulness plus bloody urine than berberis. So in terebinthina, you will see that the urine is also brown, smoky in appearance and mixed. Whereas in berberis, it's just flocculent or frothy, or it can be just, not so much advanced like you see in terebinthina. For example, in terebinthina, in urine routine report, if you see lot of pus cells, it's time to think of this remedy. This is the secret. And if you see more of, in fact, in terebinthina, it will be more of RBCs and pus cells. In berberis, it will be more of pus cells and less of RBCs. So you will see that this kind of, or there will be more sensation-based complaints for the patient rather than something coming in the urine routine for berberis. So these are the finer differences you can find out by investigating them. And for terebinthina, Dr. Nash mentions that burning and smarting while passing urine is there. We saw this also in berberis. It's there in lycopodium. It's there in sarsaparilla. Sarsaparilla will have after complaints more than during complaints. So he gives now four remedies which have burning and smarting while passing urine, and these four remedies are terebinthina, cantharis, cannabis sativa, and berberis. So all the four are useful in first stage of albuminuria. And then he tells that, whenever you get your patients investigated for long-term hypertension or just a routine checkup of kidney function tests, and you will see that their EGFR is dropping, creatinine is increasing, and in the urine routine you will see there are some albumin specks found. That is the stage where you can think of these four remedies: terebinthina, cantharis, cannabis sativa, and berberis. Mercor as a remedy comes on much later in use, and terebinthina is one of the anti-hemorrhagic remedies. You will see that there is hematuria, hemoptysis, hemorrhages from the bowels. So, if you have a complaint or a patient who directly progresses into bloody urine or hemorrhagic tendencies, think of terebinthina. The only characteristic what Dr. Nash gives is there is a smooth, glossy red tongue, which we also see in Crotella solidus and pyrogen. And there is excessive tympanitis. Abdomen will be very much sensitive to touch. You will find tympanitis when you examine the patient. Every time patient is not going to come and tell you that I am having this inflammation or this swelling or I am having tenderness. So homeopaths need to get on near the bedside of the patient and examine the patient, get the investigations done, match both the things together and find out what works well for uh, giving terebinthina. And last but not the least, Dr. Nash tells us that there is dropsy after scarlatina with smoky urine, lachesis, apis, helleborus, and colchicum are the other remedies. Continuing further, he tells that cannabis sativa is another similar remedy which has strong action on the urinary organs. Now, there is a one peculiar symptom of this remedy, and if it saves you some urinary tract infection cases, it's going to help you a lot and give you a good name in society, because these troubles take lot of time through allopathy as well, through Ayurvedic, through homeopathic as well. But if you know the right remedy, you will leapfrog much faster than what the other medicines or other doctors are stuck up with. And the characteristic symptom is that in cannabis sativa there is urethra which is sensitive to touch or external pressure. The patient will tell you that they cannot wash the part or they cannot walk properly. They are walking with legs far wide apart. That is the sensitivity of cannabis sativa. So it is particularly the urinary tract and the urethra which are infected, and the infection has spread. If the infection has spread from the urethra upwards towards the bladder or the kidney regions, both the kidney regions, there will be pain in the back every few minutes and urine will be bloody. So Dr. Nash tells in early days he used to give 5 drops of mother tincture of cannabis sativa in 4 ounces of water, 1 tablespoon thrice a day. If the inflammation used to subside after 4 days, the discharge used to become from thin to thick or greenish. He used to give Merck salt to finish the case. So he used to give Merck salt 3x, and he has given in some remedies similarly. These finer differences of prescriptive pointers with potencies and how he repeated, why he repeated. That's the magic. You should take something from him. If not the same potencies, we can employ it in different potencies, but frequent repetition or severely high potencies, we just want those. And that's what he tells after few initial years of his practice. He directly gave CM potency in the very first stage and he did not require any other remedy at all. So, in this way, if you have the confidence to find out the peculiar characteristic of the patient in cannabis sativa, it is urethra is very sensitive to touch or pressure. They may not wear the clothes properly. They will tell you the discomfort. They will tell you that they can't wash the part. They can't walk properly. Cannabis sativa should be given, and after the infection is cleared, he thinks of Merck salt, sulfur, capsicum, or kali iode. So none of the people who are in of that era, like 1900s or 1850s or that era, especially homeopaths, have told us that they have worked on their cases with one remedy. It's time to know how they cured such gruesome cases without the help of any latest technology, any battery of tests, but still they succeeded. In cases of urinary tract infections, Dr. Nash used to give sulfur, capsicum, or kali iode after cannabis sativa and used to cure patients within 1 or 2 weeks. Some such infections still keep on lingering and keep patients keep getting infections even after they are taking the right medicine of the old school practitioners. And Dr. Nash tells us that he has given cannabis sativa CM potency, and if that has not helped, he has given Merck core in CM potencies and sometimes pulsatilla and sulfur and sepia to finish the case. For example, if there is thick and green discharge after the infection has gone or subsided, Merck core is the remedy he has taught. Pulsatilla or sepia is thought by him if there is thick and bland discharge. If the discharge is cleat, which was mostly seen in that era where Dr. Nash used to practice, sulfur used to be given by him. So one characteristic which Dr. Nash found for cannabis sativa is that there is sensation of dropping around or in the region of the heart. Now this is very interesting, very unique. I have never not come across this sensation, but if you get a chance, you will get to explore this remedy. But you will find one symptom which is important and that I have found very much often in clinical practice for cannabis sativa, and that is At the end of urination, as soon as the urine is completed, there will be a sudden pain in the last drops of the urine. That is cannabis sativa. Go in Kent report, you will find one rubric where it says that there is spasmodic pain at the end of urination. Last few drops burn and smart and cause intense pain. That is cannabis sativa. You will find this in many urinary tract cases, urinary tract infection cases. Give this remedy and try to establish your cure with good results. So that's all for today's session, and thank you all for joining Homeo Setu YouTube channel, Instagram, Facebook. Keep on following, and you will get interesting learning in the year 2025 and furthermore.